Nicole Stewart joins me here live in the studio. Nicole, how are you?
I'm good. How are you?
You brought along a very special guest today.
I did.
Yeah, somebody who's been on radio and TV before, so I can just go to Dose now and get some coffee.
Right. So everyone should know her already.
Yeah,
right?
everybody should know her already.
Right.
Yeah. So anyway, Meghan is here. Introduce Meghan. Tell us a little bit about her background.
I brought my buddy Meghan, and she's with Smart Body Physical Therapy. And she's awesome, and I'm excited to learn. I'm excited for her to share with us what they do.
Absolutely. Meghan, of course, with Smart Body Physical Therapy. So, give us the quick sort of 30 seconds, if you will, of what you all do.
Okay, let me try to cram it into 30 seconds
Your
really
elevator
quick.
speech.
Yes, my elevator speech. First of all, we are one-on-one physical therapists, which means you'll come in and see us. You'll just see your physical therapist during that one-on-one time, your 20 or 40-minute spot, and you will not get bounced around, and they will not be hanging out with other patients.
So that's important, right? Because a lot of times you go into a physical therapy setting, right, and there's a lot of people getting therapy done, and you're sort of getting a little bit of attention, but then kind of left to your own devices for a while, right?
Right, exactly. Usually you get thrown into a gym with 20, 30, 50 people in some of these bigger physical therapy clinics, and your physical therapist spends 5-7 minutes with you, bounces to the next person. Your appointment may end up taking 2 hours instead of 20 minutes because they're just bouncing around. So really what that's doing for you is, number one, wasting your time, and number two, it's going to take longer for you to heal because they're really not doing as much as they should be with you in the amount of time that they have with you. Wow. So our goal is to get you in quicker and out sooner and move along.
Once again, Meghan is here live in the studio along with Nicole Stewart. But Meghan is with Smart Body Physical Therapy. You can learn more by going to smartbodypt.com. That's smartbodypt.com. And we'll put all that information up too on our Facebook page at WSOS Radio. Who are some of the folks? I mean, a typical patient these days. I mean, what are folks coming in? What are they dealing with? How are you helping them get to a better place?
Typical is very, very hard, Kevin. We have people that are pre and post-op.
Okay.
We have people with sports injuries, spine injuries, migraines. But our sweet spot, our very, very specialized area, which no one else in Florida or Northeast Florida right now can really claim, is that we are women's health certified in pelvic health medicine. And we have 11 years experience at our office with that, with two of the groundbreakers in the area, one of them being a groundbreaker in the United States. Deeper into it's a very wide range of issues, from urinary incontinence to painful sex. Basically, any woman that's had a baby should come see us for a full postpartum musculoskeletal exam to make sure that her body did not get wrecked during that pregnancy. There's just a lot of things that we can help with that doctors don't let their patients always know about.
Right.
And women are too afraid to bring up because it's embarrassing
or
painful.
Well, if you know someone in your life who has had children, or maybe they're dealing with some of the issues that Meghan just talked about, a good starting point would be to check out the website smartbodypt.com. That's smartbodypt.com. And make a phone call, too, right? Ask some questions. That's
Absolutely.
not going to cost anything, right?
Not at all.
Yeah,
and
no
we
charge.
are very happy to talk to you. Connie will most likely pick up the phone. She's super sweet. Say hi, Connie.
Say hi, Connie. I heard you were super sweet.
You're super sweet. Be nice to me.
Yeah.
Get me on that schedule.
I have to tell you, from a guy's perspective, the whole notion that you all actually have other human life inside of you and then actually, pop it onto the earth is just unbelievable. How does that happen without wrecking your body anyway?
It's pretty amazing, and they do get wrecked, and women just don't realize that there's help for that other than surgery and pills and just being miserable.
And they think that Kegels are the cure.
Right, and so many people are doing their Kegel exercises incorrectly, which can hurt them further.
Yeah, make it even worse.
Yeah.
We're spending time this afternoon. Nicole Stewart, part of our family, is here with us live in the studio. Good afternoon, Nicole. How are you?
I'm good. How are you?
And your headphones fall off your head. We were having
and I just punched myself in the face.
Yeah, that's where you really wish we had the in-studio internet camera.
I think we should, because it would be quite comical.
Yeah, it would actually be.
Live video stream.
Hey, Meghan is here, too, from Smart Body Physical Therapy. We appreciate her coming in. Of course, they're located right here in Northeast Florida. You can learn more by going to smartbodypt.com. And she's got some interesting stats for us that if you're a lady or you care about one, you should listen up.
So if you just joined us, we specialize in pelvic health physical therapy. And here are a few stats that you may find interesting according to Cosmopolitan. 24% of women still have painful sex 18 months after giving birth. 29% of mothers had pubic bone fractures they didn't know they had after giving birth. And 49% of women have urinary incontinence, which means you're leaking or peeing or however you want to say it, a year or more after having a baby. So ladies, this is really common, but it's not normal. So if your doctor, your nurse practitioner, PA, anything tells you, oh, that's common, that's just part of childbirth. No, it's not common, not normal. Come see us. We can help.
Yeah, those are amazing numbers because it's those are things that you would think, oh, okay, maybe there's 6% of women dealing with that or 4%. But when you start getting up to 49%, I mean, that's amazing.
Right. They're staggering. And that's not even including issues like pelvic organ prolapse, which is basically after you have a baby, your organs start falling out of your uterus.
Wow.
So
that whole child rearing thing's a good plan, isn't it, Nicole?
It's fantastic. I'm so glad that I have two of them.
How did you come through it so amazingly easily?
Well, Kevin.
Thanks to your physical fitness.
She's
a pro. So let's talk a little bit about that, though, the piece of, okay, so we've identified that there's so many women out there that deal with all these issues, especially after giving birth. What do you all do, without giving away all the secrets of the trade, but, tell us a little bit about what you can do to help them.
Right. So since our physical therapists are specially certified in this area, we use special techniques such as manual therapy, which is kind of a manipulation of the muscles by the hands. So it's very hands-on, and that may sound a little weird and sexual. It is not. It's kind of like you go to the OBGYN to have an exam. It's the same thing, except with a physical therapist. We're all professionals here.
Also, and are they all women?
They are. Our physical therapists that treat these issues are all women.
Okay. Which is huge for us girls because we don't really want to talk to a male about it.
Exactly. So, rest assured.
Something else you don't want to talk to us about.
Correct. This is true. So we also have state-of-the-art biofeedback, which is a very amazing piece of equipment that basically... without giving away too many details and freaking people out, a sensor goes inside of the vagina, and there is a big kind of TV computer monitor screen where it shows up kind of like an EKG and can track the contractions and how strong the pelvic muscles are.
Wow.
So, and this is in a private room.
This is in a private room. We have private treatment rooms. No, we do not display
it's not like in a room of 50 people.
It's not an Everbank Field fed live.
Absolutely not. That would be a HIPAA violation, guys.
Just a small one.
Didn't someone just get the Megatron? Did you just say that? Did I totally phase out of that? I was watching traffic.
Yeah.
So they basically... All right, Nicole's off base here.
Dory.
So basically, the physical therapist gets a lot of information from this biofeedback machine. And from that, which is usually when somebody is coming in for these pelvic health issues, if it's related to incontinence or something like that, they are often going to check the strength of your pelvic floor muscles because ultimately this is a pelvic floor dysfunction. Fun fact that not many people know is that your pelvic floor is striated muscle like your bicep. So what happens, Nicole, if you don't work out your bicep?
It's flabby and ugly.
Yeah, it just doesn't work. It's ugly. Oh, God. So it just kind of hangs there and it doesn't really do much. You're not strong. You can't do things with it. Exactly. Same thing with your pelvic floor, ladies. So even though it's not out there on display for everybody to see, that is why you're leaking. That's why you're having pain. That's why things are falling out, stuff like that. And biofeedback, our manual therapy, our exercises, and the PT regimens that our physical therapists come up with that are specialized in this area can help with all these things.
Okay, so most people might think that leaking is if you have to pee and you can't hold it and you pee a little bit, but it's a lot. We're struggling with a lot more things than that.
Definitely.
So like we're at the gym and it's time to jump rope.
Exactly. And if a little bit comes out, that means that you do have incontinence.
Right.
There are two types of incontinence. There's stress incontinence and urge incontinence. Sorry. Stress means that you're jumping, you're laughing, you're sneezing. Ladies, anybody ever sneezing a little bit come out?
Seriously.
Every day. It means that you have incontinence.
So Kevin's nodding his head. Kevin, do you need to tell us something?
I don't know if we're talking about women or a 58 Ford, It's just unbelievable. Things are falling out.
I thought you were going to say a 58-year-old man, but hey, we can help men too, by the way. They have pelvic floors as well, and we treat men as well. It's just not as common as women. Post-prostatectomy patients are a lot of our patients. But anyway, we can get into that another time. Basically, what we are talking about is the different types of incontinence. So you can have stress, you can have urge, which means you're about to miss the toilet. You have to run to it so fast and get your pants down and go to the bathroom. And then you can have mixed, which means you're so blessed and lucky and you have both. And these are really common with women who have and have not had baby. And for women that have not had babies, menopause brings on these type of things as well. So just something to think about. But biofeedback, physical therapy, can help.
There you go. Hey, we've just put all this information up on our Facebook page at WSOS Radio, but in the meantime, try to remember this, smartbodypt.com. That's smartbodypt.com if you have any of these issues that Megan's been talking about. We'll be right back. Hey, if you're just tuning in, we have a very special guest with us here in the studio. Meghan is here from Smart Body Physical Therapy, and you can learn more by going to smartbodypt.com. We just put a photograph up of Meghan as well as some contact information, phone numbers, all that kind of stuff. So it'll be sitting on our Facebook page when you get home and have a chance to look at this. But we're talking about some pretty interesting issues, you know, that I'm learning a lot today, actually. I didn't realize that we had such an issue with female incontinence and all sorts of other painful issues that a lot of women deal with on almost chronically, right? This goes on and on and on for years.
Kevin. Painful, embarrassing, you name it, and we're just kind of
does that mean
toting around
it's
dealing with it.
Another card that you can give to women when they're maybe like having a bad day or...
Oh, yeah, really.
You know, like
maybe her uterus is hurting. Maybe she's leaking right now. And you guys really need to think about these things.
Every time he sees a woman sneeze, he's going to be like,
oh my gosh, did she just wet herself? Good chance. 49% of women, like we talked about. So
we guys, men, as I'm sure Nicole's used to, we're accustomed to sort of looking in the garage to see if the car is leaking oil.
Right.
So now there's something other, we'd have to look for other leaks.
Correct. Guys need to think about it like this. You have two babies. Your car and your wife or your girlfriend.
Right.
They both have a really good chance of leaking. What do you do? What do you do with your car? You send it to the mechanic. You take care of it. Yeah. Please don't take care of your wife. Send her to us. Send her the physical therapy experts in women's health.
So you're sort of the mechanic. You're like you're the Jiffy Lube for women.
Pretty much.
For the women in our lives.
We could deal with that brand standard. That would be fine.
So maybe you should team up with like Race Tires.
Yeah, that's right.
Oh, yeah, there you go.
Yeah, you think I'm
having all types of marketing ideas right now, guys. Full disclosure, I'm not a physical therapist. Right. I do this type of fun stuff for us. But
so on break, we're talking about our friend.
Exactly.
A friend.
It is a friend.
It is a friend. Mutual friend. Yeah. That basically every time she laughs, she leaks a little bit. Every time she sneezes, she leaks a little bit.
The real problem that she was talking to us about was she had a personal trainer.
Yes.
Who was a male.
Yes.
And he wanted her to jump rope. And she kept telling him, I can't jump rope. And he would look at her annoyingly. And she would say, I can't jump rope.
There's going to be a puddle on the floor if I jump rope right now.
And then she started lifting really, really heavy weights. And when she got really heavy, she started leaking whenever she would lift those weights.
Exactly.
When she felt uncomfortable talking to him.
Which most women would feel uncomfortable talking to their male physical or personal trainer or doctor about this type of thing.
Exactly.
So basically,
so we told her, you need to talk to him. You need to say something because he needs to understand that that's not okay.
Right. Personal trainers, men and women need to know how to deal with their clients when they say, hey, I can't do that. And hoping that they are giving you like full disclosure, hey, I really can't do this because I'm going to leak in this gym or whatever it may be.
So she talked to him.
Yes.
And he gave her the look of, oh my God, I can't believe she's telling me this right now.
What do I do with this information?
Right.
And luckily enough, he's actually educated in this area. And I had a conversation with him, and he now knows a little bit more about pelvic health physical therapy and what Smart Body Physical Therapy and our therapists can do for women that are leaking.
Right. So now he knows he can send them to you.
Exactly. So personal trainers, you have people out there that are leaking or hurting or feel like things are falling out. Don't force them to keep going. You kind of need to rein it back a little bit.
To me, it would make sense to be like part of the conversation
before you start
the consultation, especially if they're coming back 6 weeks after they have a baby and they're wanting to get in shape.
Right. And that's the other thing, guys. I'm not a doctor, but you did CrossFit while you were pregnant. You did CrossFit before you got pregnant. You can't really do it 6 weeks afterwards. I know your doctors may be telling you that, but unless they are specialized in this area, they don't really know the damage that can be done down there and that you just kind of trigger and make worse through heavy lifting and just this insane activity.
Right.
So I would encourage you to get a postpartum musculoskeletal exam by one of our physical therapists before going back to that strenuous of an exercise. And
we mentioned it before, but the people that do these exams are all women.
They're all women.
Right. That's key, right?
Smaller hands.
Well, and that
they understand.
On that note,
yeah, they understand everything. They a lot of them have been through it themselves and have somebody in their family that they've helped through this.
Right.
They understand how sensitive it is. Guys may not think about this, but women that are going through this, it's actually very traumatic.
Yes.
Having a baby is a traumatic experience. But even for women that haven't had babies, there's so much that can go wrong, and you're just living with this every day. This is just part of you. It's normal. No, it's not. It's just common. Come get it fixed, or at least get it lessened.
And we just want everything to go back to normal.
Exactly. And I mean, all these companies right now are selling things that look like tampons or just big pads to absorb all your leaks because, Brooke Burke was just on a commercial for...
diapers?
Shoot, what was it? No, I think it was Poison Prezza. Like, basically, you're leaking when you laugh. Stick this in, you'll be okay. Well, would you rather basically wear a tampon every day, or would you go to physical therapy and work through it and maybe not have to deal with it after a couple months? It's just one of those things. When I think about it, we already have a time of a month that we have to deal with, and I don't want anything else to deal with the rest of the time. So it's just, why buy something when you can get it fixed? It's just like if you tear your rotator cuff, you're going to come have us look at it. We're going to work it out. We're going to get it back to where it used to be. Same
You're not going to live
with
in
your
a
pelvic
sling.
floor. Exactly.
We're wrapping up our time right now, though, with Meghan. She is with Smart Body Physical Therapy right here in Northeast Florida, smartbodypt.com. We're talking about a variety of women's health issues, a lot of women's health issues that we don't talk a lot about, including pelvic pain and incontinence and things like that. And so we're talking about it here this afternoon. And one thing we wanted to mention was, if somebody has an issue, Meghan, with, pelvic pain or back pain or some post-operative situations, typically what are we looking at here in terms of physical therapy? Is this an ongoing thing that will take months to resolve, to get better? Are we talking weeks? Are we talking years? What's the length of time for a typical treatment plan?
Well, every single patient is going to be different, especially if you're talking post-op versus, someone with urinary incontinence versus I tore my rotator cuff. But our goal is to get them in, find the appropriate plan of care for them and move forward with that, so that hopefully if their schedule allows, our schedule is we're usually very flexible. If somebody calls us, we can normally get them in the same day or at least the same week so that they can start treatment right away, which is very important. But it's really hard for me to give a timeline.
Oh, sure.
Most people are a couple months, though.
Okay.
We're not talking years. That would be a very, very, very rare case.
Because we have a lot of folks that are listening that are women that have these issues, and many of them have been dealing with these issues for years, right? So what is available to them is a solution that's not going to take very much time at all, relatively speaking.
No, really not.
The other piece of this...
Exactly. If they're going home and doing the exercises and listening to the physical therapist, listen.
No, you're right. You're right. Follow directions.
But then everything will happen a lot quicker.
Sure. So, all right. So we have that piece figured out. Women who are dealing with some of these issues, whether it's incontinence, pelvic health pain, lower back pain, muscle weakness, all those sorts of things, there's a solution. It's not going to take a ton of time. The other piece that a lot of people may be asking about, affordability. How much does this cost? Does insurance ever come into play in terms of, paying for some of it? What's your experience, Meghan?
Yep, it's all about the money. No. So basically, we have went above and beyond to try to accept every major insurance company available, and I can say right now that we do. We take, I challenge you. Give us a call and see if we don't take your insurance, because even if it's a small insurance company, we call them, we try to see if we can personally justify your treatment plan so that they'll pay it for you. We can get some visits out, but we do accept all major insurances. You can get the whole list on our website. And TRICARE families, military families, we can see all of you guys, because you are in network, which that's TRICARE Standard, TRICARE Prime. A lot of people can't say that.
Right.
So we want to get all our military families taken care of.
Well, if you have any questions at all about how long these treatments might take, how they can be paid for, the first step is to give them a call at Smart Body PT right here in Northeast Florida. You can do that at 904-296-4140. I'm going to give you that telephone number one more time, 904-296-4140. We've also put the phone number up on our Facebook page at WSOS Radio, along with a beautiful photograph of Meghan, right?
Oh, it's gorgeous.
Yeah, she doesn't think I have much of a career as a photographer. You can always go to her website, too, or actually the website for the entire practice, which is smartbodypt.com, smartbodypt.com. And Meghan, we learned a lot today. Thank you for your honest and frank conversation.
You are so welcome.
Yeah, thanks for putting up with Nicole. You did a good job.
You did.
Well, I like Nicole. She's kind of a friend.
She's a good egg. We like her around here, too. All right. Well, thanks a lot. It was good information. We hope to have you back again soon.
Thank you so much for having me.
All right. It's about 10 minutes before 4 o'clock. It's St. Augustine's, WSOS.